Heart attack. A heart attack, also known as a myocardial infarction, MI, occurs when blood flow to a section of the heart muscle is blocked, usually due to a blood clot. This blockage deprives the heart muscle of oxygen and nutrients, leading to tissue damage or death if not promptly treated. Here are some key points about heart attacks. The most common cause of a heart attack is atherosclerosis, which is the buildup of fatty plaques in the coronary arteries that supply blood to the heart muscle. When a plaque ruptures, a blood clot can form and obstruct blood flow to the heart. Other causes include coronary artery spasms, drug abuse, such as cocaine, and, rarely, a tear in the coronary artery, spontaneous coronary artery dissection. Common symptoms of a heart attack include chest pain or discomfort, which may feel like pressure, squeezing, fullness, or pain that radiates to the arms, neck, jaw, back, or stomach. Other symptoms can include shortness of breath, sweating, nausea, vomiting, lightheadedness, and anxiety. However, it's important to note that some heart attacks can be silent and present with minimal or no symptoms. If a heart attack is suspected, it is crucial to seek emergency medical care immediately. Diagnosis involves a combination of evaluating symptoms, medical history, and performing diagnostic tests. Electrocardiogram, ECG, EKG, measures the heart's electrical activity and can help identify abnormalities. Blood tests, such as cardiac enzymes, troponin, can confirm heart muscle damage. Other imaging tests like angiography, echocardiography, or cardiac MRI may be done to assess the extent of the damage and determine the most appropriate treatment. The primary goal in treating a heart attack is to restore blood flow to the affected heart muscle as quickly as possible. This can be achieved through several interventions, including medications. Aspirin, nitroglycerin, and other antiplatelet and anticoagulant medications may be administered to help dissolve the clot and prevent further blockages. Thrombolytic therapy. In some cases, clot-busting medications, thrombolytics, may be given to dissolve the blood clot. Percutaneous coronary intervention, PCI. This is a common procedure in which a catheter with a balloon is threaded into the blocked coronary artery to open it up, balloon angioplasty, often with the placement of a stent to keep the artery open. Coronary artery bypass graft, CABG, surgery. In more complex cases or if multiple blockages are present, bypass surgery may be recommended to redirect blood flow around the blocked artery. After a heart attack, the recovery process involves managing the underlying heart condition and adopting a heart-healthy lifestyle. This typically includes medications to manage risk factors, e.g., cholesterol-lowering drugs, blood pressure medications, beta blockers, lifestyle modifications, such as a heart-healthy diet, regular exercise, smoking cessation, stress management, and participation in cardiac rehabilitation programs to improve overall cardiovascular health. Congestive heart failure, CHF. Congestive heart failure, CHF, is a chronic condition characterized by the heart's inability to pump blood efficiently, leading to a buildup of fluid in various parts of the body. It is typically a progressive condition that requires long-term management. Here are some important points about CHF. CHF can result from various underlying conditions that damage or weaken the heart muscle. Common causes include coronary artery disease, blocked or narrowed arteries, high blood pressure, hypertension, heart attacks, heart valve disease, and certain congenital heart defects. The symptoms of CHF can vary depending on the severity and individual factors, but common signs and symptoms may include fatigue, shortness of breath, especially during physical activity or when lying flat, persistent coughing or wheezing, fluid retention causing swelling in the legs, ankles, or abdomen, rapid or irregular heartbeat, and reduced ability to exercise. CHF is typically diagnosed through a combination of medical history evaluation, physical examination, and diagnostic tests. These tests may include blood tests, chest X-rays, electrocardiogram, ECG, echocardiogram, ultrasound of the heart, stress tests, and cardiac catheterization. Treatment for CHF aims to manage symptoms, improve quality of life, and slow disease progression. It may involve lifestyle modifications such as adopting a low-sodium diet, regular exercise, weight management, and avoiding alcohol and tobacco. Medications like diuretics, ACE inhibitors, beta blockers, and angiotensin receptor blockers may be prescribed to manage symptoms and improve heart function. In more severe cases, medical procedures such as coronary artery bypass grafting, CABG, or heart valve repair, replacement may be necessary. Lifestyle changes. People with CHF are advised to make certain lifestyle changes to manage their condition effectively. This may include following a heart-healthy diet, monitoring and managing fluid intake, maintaining a healthy weight, exercising regularly, under medical supervision, quitting smoking, limiting alcohol consumption, managing stress, and taking medications as prescribed. Regular monitoring. Patients with CHF require regular follow-up visits with their healthcare providers to monitor their condition, adjust medications if needed, and address any concerns. Monitoring often includes assessing symptoms, blood tests, echocardiograms, and other diagnostic tests to evaluate heart function. My story. I was headed to work one morning but had to drop my kids off at my parents' for daycare. Just as I was driving up to their house, my chest felt like a balloon inflated in my chest. Every time I tried to exhale, the balloon inflated more so I could not inhale. I was taking short, gaspy breaths. I saw stars and felt like I would pass out soon. I fell out of my truck and made it just inside the house where I collapsed into a chair. I would not call it chest pain, but more that I could not breathe. It was like there was air being pumped into my lungs and it was not coming back out. By the time we got to the hospital, they wheeled me straight into the emergency room. I don't remember much after that. They said I has in a heart attack. They took me to a room to do a heart catheterization, but were unable to do it. I was given some meds to thin my blood for the cath, but then had to wait for them to transfer me to another hospital in a nearby town to do open heart surgery. I ended up having a double bypass. 2 arteries in my heart were clogged. They said the damage to my heart from the attack left my lower right lobe of my heart necrotic, dead. The surgeon explained this to be a widowmaker attack. He said I was lucky to have made it. What I didn't tell anyone is, when they were getting me ready to go to surgery, I kept feeling someone's hands reaching around the head of the bed and hold my shoulders. They were warm hands and I felt safe and comforted. My family saw me trying to look behind my head as I was trying to see who was there. But it was the wall. I knew Jesus was with me and I never was afraid. If you found this informative, please click the subscribe button. Thanks for checking.